Welcome to today's lecture on advanced techniques in medical practice. We will explore topics such as hemodynamic monitoring, pulse assessment, temperature measurement, and more. By the end, you will have a thorough understanding of these essential aspects of medical evaluation and monitoring. Let's begin. Hemodynamic monitoring involves assessing cardiovascular function and fluid status. Invasive methods measure pressures directly through catheters, while non-invasive methods estimate cardiac output and assess fluid status. The choice of method depends on patient condition and clinical setting. Pulse assessment is vital in physical exams. Palpation is the primary method to gauge pulse amplitude and regularity. Specialized devices assist in accurate measurements. Factors like age and medication help interpret findings. Traditionally, measuring body temperature has involved the use of invasive methods like rectal or oral thermometry. However, advancements in technology have introduced non-contact methods for temperature assessment, such as infrared thermometers and thermal imaging devices. These techniques provide quick and convenient measurements without physical contact with the patient. Understanding the principles, accuracy, and limitations of these methods is crucial for effective temperature assessment and monitoring. Pulse oximetry is a valuable tool for assessing oxygen saturation levels indirectly. By utilizing specialized devices, clinicians can estimate the percentage of hemoglobin saturated with oxygen non-invasively. However, it is important to be aware of the limitations and factors that may affect accurate measurements, such as poor peripheral perfusion, nail polish interference, and motion artifact. Understanding these considerations allows clinicians to interpret pulse oximetry readings with accuracy and make appropriate clinical decisions. Blood pressure variability refers to the natural fluctuations in blood pressure values that occur over time. It is an important parameter to consider in assessing cardiovascular health and the risk of various complications, such as cardiovascular diseases and target organ damage. Understanding the factors influencing blood pressure variability, such as circadian rhythms, physical activity, and stress, helps clinicians interpret blood pressure readings and implement appropriate management strategies. Capnography is a valuable tool for assessing ventilation and respiratory status by measuring end-tidal carbon dioxide, ECO2, levels. It provides information about the adequacy of ventilation and can help detect abnormalities like hypoventilation, hyperventilation, or ventilation perfusion mismatch. Utilizing capnography in critical care settings, respiratory emergencies, and procedural sedation enhances patient safety and assists in clinical decision-making. Accurately assessing pain is crucial for appropriate pain management and patient comfort. Utilizing standardized pain assessment tools, such as the Numeric Rating Scale, NRS, or Visual Analog Scale, VAS, allows for a systematic approach to pain evaluation. Additionally, techniques like observing behavioral manifestations, assessing vital signs, and monitoring response to interventions provide a comprehensive understanding of the patient's pain experience. Implementing effective pain assessment strategies ensures optimal patient care and promotes patient satisfaction. Central venous pressure, CVP, monitoring provides valuable information about right atrial pressure and fluid status in critically ill patients. It involves the placement of a catheter into the central venous system, such as the internal jugular or subclavian vein. Indications for CVP monitoring include septic shock, cardiac tamponade, or fluid management in patients with compromised cardiac function. Accurate placement and interpretation of CVP measurements are essential for guiding fluid resuscitation and optimizing patient hemodynamics. Pulse pressure, the difference between systolic and diastolic blood pressure, carries valuable information regarding arterial elasticity, cardiac output, and stroke volume. Assessing pulse pressure dynamics aids in evaluating cardiovascular health and detecting conditions such as aortic regurgitation, arterial stiffness, or conditions associated with increased pulse pressure, for example, hyperthyroidism. Understanding the principles behind pulse pressure analysis enables clinicians to identify abnormal findings and consider appropriate diagnostic and management strategies. Assessing tissue perfusion is crucial in evaluating a patient's overall hemodynamics and tissue oxygenation. Physiological markers like capillary refill time, skin color, or temperature offer insight into tissue perfusion status. Prolonged capillary refill time, pallor, or skin mottling may indicate compromised perfusion, which could be due to shock, peripheral artery disease, or other conditions. Understanding the relationship between tissue perfusion markers aids in timely recognition of critical situations and facilitates appropriate intervention. Monitoring respiratory patterns offers valuable information about a patient's respiratory function and underlying pathologies. Recognizing abnormal patterns, such as Cheyne-Stokes or Kussmaul breathing, assists in diagnosing and managing various respiratory conditions, including congestive heart failure, metabolic acidosis, or neurological disorders. Analyzing respiratory rate, depth, and rhythm significantly contributes to the overall assessment of a patient's respiratory status and aids in providing appropriate interventions. Orthostatic hypotension refers to a significant drop in blood pressure upon assuming an upright posture. It is an important indicator of autonomic dysfunction or volume depletion. Assessing blood pressure changes in supine and standing positions allows clinicians to identify potential causes, such as medication side effects, autonomic neuropathy, or hypovolemia. Recognizing and evaluating orthostatic hypotension aids in appropriate management and preventing adverse outcomes. In conclusion, this video covers advanced techniques and assessments in medical practice, such as hemodynamic monitoring, pulse assessment, temperature measurement, pain assessment tools, and respiratory evaluations. Understanding these topics is crucial for providing optimal patient care and making informed clinical decisions. Keep practicing and exploring these concepts to become skilled practitioners. Thank you for your attention, and I hope this video helps you in your studies and future medical practice.